Hello, this is Talking Threads, applied form for healthy conversation from Zulekha Hospital, Sharjah. Today, I am with you, Dr. Ahmed Nabil, Pediatric Surgery Specialist, with my colleague, Dr. Shabna, from Anesthesia side. Today we will try to cover one important topic for small children about inguinal hernia from surgery side and from anesthesia side. Welcome, Dr. Shabna.
Thank you, Dr. Ahmed Nabil. I am Dr. Shabna Dilber, Specialist Anesthesiologist from Zulekha Hospital, Sharjah. Pediatric and infant anesthesia may sound daunting, but it is extremely essential to keep our little ones safe during the procedure. And as anesthesiologists, we take extreme care to deliver the most precise management plan and anesthetic plan for your child. So, doctor, on behalf of the public, can I ask you a few questions about inguinal hernia?
Sure.
So, can you explain what's inguinal hernia?
Inguinal hernia in children is different than inguinal hernia in adult. In adult, it is a muscle weakness or muscle tear, but here in children, it is of embryological origin. Small hole between the abdomen and the groin should close by birth. It didn't close, so it allowing some of the content of the abdomen to come out the abdomen to the groin area, scrotum in case of male or labia in case of female, and this is what inguinal hernia.
Okay, so how soon should be operated, doctor?
Inguinal hernia, normally when mother detects a small lump or just a mass or a swelling while she's changing diaper, at this situation it is not an urgent procedure. What we are telling, it should be done within the coming 4 weeks. It is not urgent at this site, but you have to do within the coming 4 weeks because it has a high incidence of obstruction. So we are advising and pushing families, please do it as fast as possible. Another question, doctor, some mothers saying when we are surfing on internet, there is some studies or some sites that telling anesthesia will affect your child's ability to learn and his mental development. Is this right?
Actually, doctor, till date there are no conclusive evidence for this. We have been doing many studies for the past many years, but no conclusive studies point to this fact.
Yes,
so
okay.
It's like, and this anesthesia protocols we are refining, redefining every year so that we administer the smallest effective dose and for the shortest duration of the surgery.
In anesthesia for children, you are depending mainly on the general anesthesia, or if there is a window or possibility to use the local anesthesia, you are mixing both, or depending only on local. What do you prefer in general? What's your plan when you have a child we are planning for surgery?
We plan the pain management the time we see a patient in the pre-anesthetic clinic. It depends upon the type of the surgery, duration of the surgery. So we start our pain management plan with oral medications, and it can be supplemented with intravenous medication, rectal medication like rectal suppositories we can keep, and also regional anesthesia techniques, which include installation of the local anesthetic agent to the epidural space, which can be called the caudal anesthesia, or installation of the local anesthetic agent to the site of surgery by the surgeon or the anesthetist. Mm-hmm. That is the local anesthesia.
Is the use of local anesthesia really decreasing the total dose of general anesthesia, making general anesthesia less, let's say, less stressful for the children? This is right?
Yes, of course, it is absolutely right. If we increase the dosage of the local anesthesia and the regional anesthesia, it can definitely reduce the amount of general anesthesia which is being administered to the baby, thereby reducing the risk. We don't know exactly the risk. As I told, there is no conclusive studies as of now. So it can absolutely reduce the amount of general anesthesia which is being administered to the baby.
Okay.
Okay, doctor, can you describe the surgeries which are being performed for the same, like inguinal hernia?
For children lower than 6 months of age or smaller than 6 months of age, we are using open technique, small incision in the lower inguinal area, less than 1 centimeter or almost 1 centimeter. It is totally without suture, plastic surgery, and after there is a very minimal trace that can be even hidden by the hairline or even by the swimming suit. For older children, older than 1 year, we are using laparoscopic surgery, 3 or 2 tiny holes, and also it is hidden and not shown in the future. Doctor, in my clinic, when patient came to me, they usually asking about, after they know about the surgery, they are asking about anesthesia. The most asked question, it is safe for my infant? Is anesthesia safe? How you can tell them?
Anesthesia is generally safe when it is administered by trained anesthesiologist. And according to we administer anesthesia according to the latest guidelines and protocols, in which we administer the exact dose tailored according to the baby's weight, age, medical history, and the type of the procedure. Can you describe the surgical steps or procedures, or what are the surgeries you usually normally do for this?
Inguinal hernia is one of the most common surgeries we are doing for small children at the child age or the infant age, plus some other conditions like undistended testes, like circumcision, like all of this. But for the inguinal hernia, for the surgery, simply we are doing small incision at the inguinal region. It is almost 1 centimeter. Doing the surgery, it is closed without suture by plastic surgery, and even if there is a small trace, it will be hidden by the hairline or by even swimming suit. Nothing. This is for the smaller ages like 1 month, 2 months, 3 months. After the age of 1 year, we are doing it by laparoscopic surgery, small, tiny, 2 or 3 tiny holes in the abdomen, and this is everything. Nothing to worry about.
Okay. Do you use a mesh normally, or?
This is one of the most asking questions from children, from families about the mesh and the complication of mesh. But in small children, we are not using mesh at all. Simply, it is an embryological defect. We are closing this defect. As I mentioned before, in adult, it is a weakness in the muscle. So they are strengthening the muscle by the mesh. In children, we are not using this at all.
Okay. So can you tell anything, like something about the recurrence rate?
Recurrence rate is very low with inguinal hernia, usually about 1 to 2%. Only in some certain situations, like if a children having some conditions that may increase the abdominal pressure, like someone who having hydrocephalus, who having this peritoneal shunt, who having some chronic chest issue leading him to cough too much, we are informing family, there will be a little higher recurrence rate, but in general population, recurrence rate is very low. It's very low.
So, doctor, can you tell me something about how long will the child take to return back to normal life, or something about the recovery period after surgery?
Okay. Generally, inguinal hernia surgery is 1 day surgery. Children can come to the hospital at the surgery day, morning, or at the night of the surgery, doing the surgery. After complete awakeness, having their food, they can go home. In very limited situations, we are keeping children in hospital in case of premature children, in case of any other conditions, in case of any other disease, and this is very limited. This is about the short-term recovery. For the long-term recovery, when the child have to normal life, to go to school, all of this, from the 2nd or 3rd day, they can go to school, they can have normal, ordinary life. But we are informing families or advising them for the aggressive playing, for the gym, for like this, we can wait for almost 3 to 4 weeks. But during this time, they can have their normal life, riding a bicycle, going to school, going home, everything is okay. This is from recovery point.
Okay.
But in my clinic, when patients come to me, also they are very worried about pain, and the most stressful point for them is the pain before surgery in the form of fasting, and the pain after surgery, like how you can deal, or what is your plan to manage both fasting and pain after surgery.
Okay, doctor. The American Society of Anesthesiologists recommends at least 4 hours from the time of breastfeeding till the time of anesthesia. That is for breastfed babies.
Okay.
In case of the formula-fed babies, the time duration will be longer. That is, it requires typically around 6 hours from the time of the last formula feed till the time of anesthesia. And for the older children, it is like 6 hours, it's 6 to 8 hours between the last feed and the start of anesthesia.
Some families are asking about fasting. Is this complete fasting? Yani, can I give him some water, some juice before surgery, or complete fasting?
Actually, juice with pulp are not at all allowed. But you can keep the baby comfortable and hydrated by giving him sips of clear liquids, clear water till up to 2 hours before surgery.
2 hours, and till 2 hours he can have water. It's okay.
Yes. Till 2 hours before surgery, you can keep him well hydrated, but make sure no pulp, no milk, and no juice.
Okay, for post surgery, in this critical time after surgery, I think pain is maximum. How you are dealing?
See, like pain management is an ongoing process. We plan about the pain and the pain management the time we see the patient first in the pre-anesthetic checkup. So during the surgery and after surgery, we assess and reassess the baby and give the medications according to their weight, age, and their medical history, and also depending upon the time of surgery. And our expert medical team take care of the pain as and when required according to the need.
At this point, we reached the end of our session. We hope you all enjoyed, and we hope we may cover some points that may come to your mind regarding the surgery and regarding anesthesia. Keep safe, and inshallah we'll meet you soon in another episode with different colleagues to cover another topic. Thank you.
Thank you for joining with us in the Talking Threads. We believe you gained some insight to the subject of inguinal hernia, the surgical part, and the anesthesia part associated with it. See you soon with another topic in another session later.